Hi everyone, today I will be performing Resident Fall. So I'm going to act out my part and then I'm not going to act out the patients, but I am going to act like the patient is there, obviously. Hello Mrs. Smith, I'm your CNA, I'm here to check on you. I'm going to be closing the door and then I'm going to be seeing the resident on the floor. Oh, I see that you were on the floor. I'm going to stay with you and make sure you are safe. And then I am not going to pick up the resident. I'm going to be asking Mrs. Smith, can you tell me what happened? Are you having any pain? Where does it hurt? And then they're going to tell me what happened. Obviously, I'm going to pretend to use the call light. I'm going to press it. I'm going to use the call light to get the nurse immediately. And then I'll obviously get the nurse. All right, I'm going to be on the call. Hello, I need the nurse in room 12. The resident has fallen and is complaining of hip pain. Okay. Mrs. Smith, please stay still. I'm going to stay with you until the nurses arrive. Try not to move because you may have an injury. Okay. Hi, I found Mrs. Smith lying on the floor beside her bed. She's complaining of a hip problem. I did not move her. She is awake and she is responding to me. I did use the call light and I did stay with her. I would also like to report any other observations, such as where she was found, her level of consciousness, visible injuries, bleeding, changes in behavior, or complaints of pain. All right. To keep the resident safe, I would keep the area clear, provide privacy, stay with the resident, and follow the facility's emergency procedures. I would also get additional help as directed by the nurse. What I would not do, there are several things I should not do after a resident has fell. I should not immediately lift the resident, pull them into a bed or a chair, give them any food or any drink, or even leave them alone. I should also not assume that the resident is okay just because there is no obvious injury. Some injuries may not be immediately visible. And then there's going to be me being the CNA. After the resident has been assessed and cared for, I would document according to facility policies. I would record objective facts such as the time and location of the fall and what I have observed, the resident's complaints, who was notified, and what actions were taken. I would avoid making assumptions or blaming the resident. Alright, during an emergency, I need to remain calm and communicate clearly and respectfully. I should work with the nurse and other healthcare team members and follow my scope of practice. In this situation, my priorities as a CNA are to protect the resident from further injuries, call for help, stay with the resident, report my observation to the nurse, and follow facility procedures. This is the proper CNA response to a resident's fall. Thank you.